Blindness and visual impairment are among the 10 common causes of disability in the United States. Visual impairment is defined reading the Snellen chart worse than 20/40 but better than 2200. Legal blindness is defined as Snellen reading equal or worse than 2200. Since visual problems have such impact in quality of life, safety and functional abilities prevention and treatment are a priority. The most common eye problems in elders are: presbyopia is the gradual loss of eye ability to focus on close objects. You may become aware of it when you start holding books and newspapers at arm length, usually starting in your mid-40s. It can be corrected with prescription eyeglasses or non-prescription reading glasses. Surgery is also an option. Eye floaters are spots in your vision which look like black or gray specks or cobwebs that seem to float around when you move your eyes. Although they are normal, changing and aging, if you see many floaters or flashes of light, it may be a sign of a medical emergency. Tearing of watery eyes can be caused by increased sensitivity to light, wind, temperature, changes from having dry eyes. Eye drops and sunglasses may help. Dry eyes. They occur when tear glands and do not work well. They feel uncomfortable because the eyes sting, itch, or burn. Treatment may include using a home humidifier, eye drops, or ointments to lubricate the eyes. Eye problems such as red or swollen eyelids, itching, tearing, or crusting of the eyelashes during sleep. They may be due to blepharitis and can be treated with warm compresses and gentle eyelid scrubs. Age-related macular degeneration. More than 1.6 million American adults suffer from the disease and is the leading cause of visual limitation in elder adults. The cause of macular degeneration have not been exactly set, but it has been related to smoking, family history of macular degeneration, and high cholesterol. AMD usually progresses slowly and painless. There are two forms of macular degeneration, dry and wet form. The dry form is the less severe and is manifested by the need of more light when you're reading or doing close-up work. Becoming increasingly blurry and street signs are also challenging to recognize. With time, there is an increased difficulty to adapt to low illumination levels. Blur or blind spots in the center of the visual fields and a profound drop in the central visual acuity. Difficulty in recognizing faces. As the disease gets worse, it will become more challenging to read, to watch television, or drive. With wet macular degeneration, new signs will appear and progress rapidly. Visual distortion will appear, such as straight lines giving the impression of wavy or dark street signals seeming out of whack, or objects appearing smaller or farther away than they really are. Decreased central vision and central blurry spot. Cataracts. Cataracts refer to any form of opacity of the lens. About half of the general populations between ages 65 to 75 will develop cataracts. It is the most common treatable cause of visual impairment in the elderly. Risk factors include diabetes, smoking, alcohol, trauma, family history, sunlight exposure, steroid therapy, and uveitis. Symptoms include blurry vision, foggy or fuzzy vision. Color perception may be affected. Driving at night may be difficult. The most common objective finding of a cataract will be reduced visual acuity, and a direct ophthalmoscope will appear patchy dark opacities. When changes in eyeglasses are no longer effective, surgery is indicated. Over 90 to 95% of patients achieve visual acuity 20/40 or better, improving quality of life and getting self-independence. Glaucoma is a significant cause of blindness in the world. It is related occurring in about 10% of the people older than 80 years old. Glaucoma is a group of ocular diseases characterized by elevated intraocular pressure that progressively damage the optic nerve, resulting in optic atrophy and visual field loss. Open-angle glaucoma accounts for 80% of cases and is asymptomatic until very late in the disease. The gradual loss of visual fields may go unnoticed until the central vision is unaffected. It is usually bilateral but asymmetrical. The etiology of glaucoma is unknown, but risk factors include age, family history, central retinal vein occlusion, ocular tumors, age, family history, hyperopia or myopia, ocular trauma, uveitis, hypertension, and eye surgery. Early detection, lifelong treatment, and follow-up care preventing blindness. Eye drop reduces the intraocular pressure. It is important to teach the patient to steal the drops on time and do not skip doses. Surgery is used when drugs are not effective. Diabetic retinopathy is the leading cause of blindness in the elderly suffering from diabetes mellitus. It is strongly related to the duration of the diabetes. Some blood vessels that nourish the retina are blocked, depriving certain areas of the retina with their blood supply. The blood vessels are very friable and bleed easily. Hemorrhage and detachment of the retina can cause vision loss. Retinal detachment. This is a true medical emergency. Occurs when the retina separates from the back of the eye. It can develop in persons with cataract surgery, trauma, or may occur spontaneously. It manifests with new floaters or light flashes, or as a curtain coming down over your eyes. It's always important to have indications of how to cope with your visual impairments. Avoid driving in certain conditions at night in heavy traffic, bad weather, or highway. Use public transportation or travel with others. Look for shuttles, volunteer driving, network, or rides. Optimize your vision using the right glasses. Look for large print books or magazines. Use magnifiers. If possible, get appliances with large print. Reduce home risk. Don't become socially isolated. Take advantage of networks. Talk to your healthcare provider about receiving professional help improving your home and safety conditions. And use low vision aids. There are some recommendations to help you slow disease progression. As your physician, go to assess your vision at least once a year if you are over 65. Stop smoking, manage your other diseases, take your vitamins and minerals, and use sunglasses. Prevention and early detection and treatment are critical in the preservation of visual acuity. It is important that all elder patients to have at least an annual eye evaluation to rule out AMD, and if it is diagnosed, it is mandatory to follow up your physician's orders and instructions. Please take care of your vision.